Not long enough, right? Not, I don't think it's ever long enough. Kind of like the weekends, I'm like, it's never long enough. But I think it was sufficient enough. It was a pretty relaxing break. And so welcome back. So for this afternoon, after lunch, we are going to kick off with an activity from my staff. And so I will let Jennifer, if she is here. Yes, I see her. I'll let her take control.
Hello, everyone. Welcome back. Hope you enjoyed your lunch. We've had some amazing presenters and some great activities so far. So we're going to kick off the beginning of the afternoon with our form of speed dating. We call it speed networking. And so the idea is when we get in breakout rooms, I know if you noticed this morning, either it takes a really long time to get people to get comfortable to start talking, and most people just want to talk like at the very end when it's almost over. So the idea of this is to give you the opportunity it's going to go fast rounds. And so you're going to get the opportunity to meet people that you've maybe never had the opportunity to ever speak with. And so the idea of this is for us to get to know each other. And it's going to go by pretty quickly. And so we're going to go in rounds. Everybody's going to be in breakout rooms. And the idea is to build off of what we started this morning with our 5 words about, what we do in our community and what we do in our programs, and give you the opportunity to introduce yourself and to meet new people that work within the OSAP team and all of our participants, to get the opportunity to meet each other if you haven't had that chance yet. So Andrea or Jennifer, whenever you're ready. I hope you guys have fun. Don't be shy.
Okay, breakout rooms have been opened. Welcome. We are currently in a breakout room session, so we'll be closing in 60 seconds. So let's just hang out here for a bit.
Hey, Jennifer, I was the only one in my breakout room, so I left.
Is
Thank
it
you.
still open?
No, we're going to close it. They're going to go ahead and do another set of it. So
Okay.
yeah, let's just stay put here for a bit.
Right.
Welcome back, everyone. It's going to take just a minute and then we're going to kick off into our next breakout room. So as you see, the time goes by really quickly, much faster than you think.
Hey, Jennifer, it's Bernie. I was the only one in my breakout room, which is fine with me, but I don't think that was the intention.
No, absolutely not, Bernie. So those that were invited to join into your room either denied or did not join, but there were 2 assigned there. So we're going to try this set one more time with random people, and hopefully you do have someone in your group.
Do
I
we
was
have
4 minutes
specific
late.
instructions or are we just supposed to chat?
No, the idea is just to chat and get to know somebody different that you
Okay.
may not usually work with. Introduce yourself, talk about where you're from, what your projects you're working on. It's just an opportunity to just network out and meet new people. The idea is kind of like a spider effect. It gives you the opportunity to go to different places, meet new people.
And as you keep getting into breakout rooms, you've already been in the middle of something that you probably got cut off and you're ready to talk once it begins once again.
Here we go again.
All right, when you're ready, I can open the breakout rooms.
All right. Thank you, Jennifer.
Hello, everybody, and welcome back. So we're gonna take another minute while Jennifer sets up the next set of breakout rooms. I hope that you're getting the opportunity to meet new people that you haven't had the opportunity to previously meet. And getting a feel for what, different communities do.
I just want to add, Jennifer, that a lot of people are not joining into breakout rooms. So there are people that are going to be, for those that are joining, they find themselves alone in the breakout rooms. So we do have a lot just hanging out here in the main room. So please be understanding, guys, if you are stuck in a room by yourself. It's out of our control in a way.
And I apologize. I really encourage you all to get into the breakout rooms and take this opportunity to meet new people, meet different staff members that you don't have the opportunity to always talk to. And it's just a chance to get to know new people.
It's low risk, high reward.
Yes, thank you, Anne.
I got to be in a room with Bernie
Ooh.
with some pretty awesome folks. So let's keep this going. I'm fully enjoying myself.
All right, I'm ready when you guys are.
All right.
Go ahead,
right.
Jennifer. Thank you.
Let's go. Let's go.
Like speed dating.
It's speed networking.
Yes, there we go.
Did you guys not get an invitation to join a breakout room?
I got one, but I was called away with something else, so I'll go and join it.
Thank you. Anyone else?
Okay, Michael, tell me a person you met in your group.
Meredith,
Nice. But you should already know who Meredith is.
yeah, well, then,
my
okay,
God.
I'll tell you someone I don't know. I'll tell you someone I didn't know. I didn't know Carla. Carla was in my group too. I didn't know her then.
I didn't know Meredith. Meredith is very nice. Never seen her before, but now I know who she is.
She was extremely nice.
Yes.
Wonderful. All right. I see our youngest preventionist on screen. I see Buck. Oh, I just enjoy seeing her beautiful face. She just makes my day, huh? She makes my day. The kids, when the kids come on screen, changes my whole attitude, my whole mindset, and I just appreciate her being on screen. Ah, yes. All right, here we have one more, right? We can do one more.
Okay, breakout rooms
Ready?
are opening.
All right, hang in there, everybody. Hang in there.
I didn't get a breakout room assigned. I don't know if that was intentional. Maybe I've talked too much today.
Jen,
Oh,
Jennifer,
there we go.
can you send me to a breakout?
Yes, absolutely.
Thank you. Hi, Alicia. Hi.
All right, Miss Natalie Skogerbo, tell me, did you meet somebody new today?
Yes, Michael
What?
Miller.
Oh, and you, Michael, you need to know who Natalie Skogerbo is.
Yes, I do know who
You
she
need to
is.
know
She's the
who-
evaluator out of Torrance and Bernalillo school districts.
Mhm. Yes,
I
and
also
I go way
met
back.
Art Salazar so that was good too. Thanks.
Wonderful, wonderful. Thank you, Natalie. All right. So we're getting just a mixture of folks, and I was in a session with someone I've known for a very long time. So we got to chat. I'm like, I'm gonna take advantage of this. Okay. So now we are wrapping that up, and thank you for your participation in this activity. This was something, you know, we wanted to try something a little different, and my staff wanted to try something different. Jen, do you have any final words or any closing words you would like to say, or Carla or Michael? I'm not sure who's gonna wrap it up.
Well, I do want to give some of the credit to Michael for coming up with this idea. Him and Jen were the main creators of this. So thank you, Michael and Jen. And I think it was a great activity. I hope you guys had fun and you got to meet people that you'd never seen or heard. I did. So if you guys like it, let us know and we'll continue to do it for next time.
Yes, the main idea was to eliminate the awkward silences, to actually have something to say, because you're going to get cut off and you got to get it out, and you're going to have it ready by the next go round. Absolutely. So it certainly did work on my end for sure.
Thank you. Thank you. Good job, OSAP staff. All righty. So now we move on to a panel. So we have a panel. I'll be moderating for this panel. And so can we please have, we have Anna Kretsky from San Juan County Partnership and Aline Toya from Presbyterian. I can't see. And then we also invited Ardina Orozco from Muscalero Prevention Program. So those are the three ladies who will be assisting me today by answering some questions. And so I will start off with the first question. Let's see, and whoever feels willing to go first, please start. My first question is, please, the topic for this conversation is leveraging prevention funding. Leveraging prevention funding. All right, my first question is, please provide us an example of how you leverage funds to conduct a community event.
So I just jump right in and get going?
Sure, thank you, Anna. Yes.
Sure. Okay, leveraging funding. So my organization, I think I can't even tell you how many grants I have right now, maybe 17, might be 18. And they run the gamut. So these are not all prevention grants. We are a community action agency that does focus on prevention, education, and general community wellness. So like we have several grants from the Department of Health, one with Healthy Kids, Healthy Communities. So that really focuses on healthy foods in our community, and like farm to school programs, which are super successful here. And we have a housing assistance program. So the majority of the funding that we receive on an annual basis, really in terms of just dollars, goes into rent, utilities, security deposits, and things of that nature. Various programs such as the Linkages program, which works to support people who have substance use issues or mental health issues, and usually co-occurring, that need housing supports to prevent them from living on the streets. And we have permanent supportive housing, which also works with people who have a disability, either mental health or physical disability. And we pay their rent because these are folks that often don't have, are unable to hold employment. Anyway, so just to give context for the different types of programs we do. So when I'm thinking about sort of leveraging prevention funding, I take in a lot of different pieces into account. So one of the things that we do every 2 years is an event called Creating Cultural Harmony. This particular event offers CEUs for anybody who is a preventionist, who needs extra credits in the community, as well as for social workers who may need their cultural CEUs. So like myself, I need prevention CEUs and I need social work CEUs. So I have to find ways to get all of those for licensure and certification every 2 years. So the Creating Cultural Harmony Conference, we've set it up so that it meets those criteria. So it gives you 6 hours of prevention and or cultural CEUs for licensure. So in order to run that particular event, it does not make money. So our goal is not necessarily to make money with this. We're a nonprofit. We don't look at trying to make a profit on anything, but we try to make sure that we're meeting a need in the community. So we partner with and working on building this and increasing this partnership with the city of Farmington, which has a community relations committee. That community relations committee came out of a time when we had some pretty extreme issues happening in Farmington around racism. And in order to address the needs of this community, which is incredibly culturally diverse, this was one of the programs that was put in place. So the community relations committee is run by the city of Farmington. And so they support this work, and this past year and next year, it'll be on April 12th if anybody's interested, but we have the use of the Civic Center for free. So a lot of the work we do and a lot of sort of when I think about leveraging is getting in-kind support from community and maybe individuals or organizations. So having the Civic Center as an entire building in order for us to facilitate this conference is pretty significant. So we utilize the outside space and the inside space. Last year, we partnered also with with the Arts Council. And so we had artists who were able to bring their wares and sell in sort of the open spaces in between breakouts, as well as during the lunch hour. We had food trucks that came to during the lunch hour that people could get their lunch at. So we make it more of a collective community activity. So partnering with the city, having other agencies and nonprofits within the community tabling or bringing them in to give a particular workshop. We do often bring people from other parts of the state as well to kind of emphasize the cultural component. And last year we focused on storytelling. And this year we're focusing on culture as prevention. So that's our theme, is to really focus on the diversity of culture within our region and across the state, to really try to hammer home how important it is to honor those pieces and how much that celebrates understanding prevention, understanding treatment, and supporting the community. So when I talk about leveraging, it's about really connecting with those other members in the community who have similar passions that you're doing, bringing them to the table, giving them opportunity, and then all of the costs are significantly less for putting on an event.
Thank you so much. That's a wonderful example. Ardina or Ali?
Yeah, hi, afternoon, everybody. I can go. I can actually piggyback off of that because we're very similar at Presbyterian in actually all things that Anna just spoke to. But you know, I have a specific example where we partnered this past year. So I've worked in nonprofits for years and never had a lot of funding. I've never, you know, before coming to Press, very small systems where I had to actually go out and find funding. And so what that meant for me is like, okay, go find agencies that have more funding that can help you put on an event because you have nothing. So I need you to do these goals and objectives, but you have no funding to do it. So I'm used to actually really going out and doing the groundwork to get that, to make that happen. So, you know, working at Press, it's such an amazing thing because it's just such a large system. You know, so much support already built in within the system and so many great community partners. And so that's one of the things I really, really want to speak on is that community engagement and that partnership. And that's really key. So within the Partnership for Success program that we're currently working under, we've made so many connections within the community, internally, externally, which really helped us grow our program. You know, so it's key in building trusting relationships, not only with your internal partners, but external partners, really being transparent, you know, and trustworthy and upfront with what your goals and objectives are, what you need from them, how you would like them to support your programs, and then also how can you support their programs as well. So, you know, bringing those relations into all parts of your programming from start to finish, how you can help them now, how you can collaborate with them and their initiatives, being involved and supportive of their programs will help build this trusting relationship that you need in the forefront. So in any professional career that I've ever had, the key to developing those relationships is building that trust, being supportive of their relationships. So I attended a conference in 2021 for the Native American Partnership, and they spoke about needing help in the behavioral health substance use world. So after that conference, I'm like, oh, hey, you know, I just started this new program at Presbyterian. I reached out to the coordinator of the event. I said, hey, I'd love to meet with you for coffee. Let's talk about, you know, how we can help you build out that your needs. So met with her in person. We talked about, you know, what their goals, their program mission, vision, initiatives were, and how it really aligned with ours. I gave her a brief overview of our program, the Partnership for Success, told her what we were able to provide. Now, how can we collaborate? So ever since that day, we've had a working relationship. I have multiple team members from different teams sitting on the planning committee for that conference. And we helped put together their annual conference for 2022 at Recipient. And it was a huge success. And really, we had over 230 people there in attendance. My team was able to provide some of the training. We were able to help them get all the guest speakers and, you know, partner with all community partners to bring in presenters, vendors. And, you know, the great thing about it is the only cost that came out of Presbyterian was the cost for my employee time. So that agency had a ton of funding that they needed to spend down. So they hosted the event, they paid the speakers, they had the food for the venue. And we helped on the planning committee. It was a lot of time and effort. You know, we brought all the guest speakers to them. But what I'm speaking to is all those great relationships and partnerships we built in the very beginning. I was able to reach out, my team was able to reach out and say, hey, you know, we're working with the Native American Partnership. We have this conference coming up. We'd love for you to be a guest presenter on trauma-informed care. And absolutely, they said, yes, how can we help? So, you know, it's really about, the key is about community engagement, bringing them into your program from the jump, you know, letting them be a part of your programming and you also supporting their initiatives as well. And just to say, we're planning that conference again. It's going to happen in November. So I'm going to send you all the agenda, the registration. We'd love for you to be there.
Thank you, Aline. Ardina?
if I can work this.
We heard you and then it went off.
Okay, got it.
All right.
Okay, so leveraging for community events. One of the things is become a pro at that. Trying to get people to come together to put on an event, anything like that. We participate, of course, in our health fairs that are here. But one thing that we just accomplished, I guess, was we put on a youth conference for spring break. And so I invited a lot of different community programs to our a planning session and asked them, you know, would you like to take part in this? And we had several different tribal departments come in and say, yeah, we want to, you know, reach the youth and whatever, you know, activities that we were doing. So we partner with them, had them be included in the goals and objectives, let them know what we needed to accomplish with the conference, what their goals and objectives were, you know, things like that. And so we were able to, like I said, collaborate on putting this event together, and it was successful in the sense that we held it. It was 3 days, I believe, and got everything paid for, from the food to the t-shirts that we gave away, bags, stuff like that that people had, you know. And so you really got to me, is look for the freebies that people want. You know, they want a pin or they want a bag or things like that. And there are a lot of organizations out there that are willing to donate those type of items. You know, sometimes a lot of our grants are restricted in buying or purchasing those type of items, but there are programs and things like that that are, they'll say, well, what do you need? Well, I need, you know, some bags. Okay, how many do you need? Well, I need 200. And they'll put it in the mail for you. You know, there's a lot of different places that will provide a lot of freebies that kids like, or things like that. So, you know, working with a lot of these departments that are willing to give that out. So, and just the biggest thing that I can, I guess, piece of advice is collaboration. Collaborating with people that you don't think would, you know, that you would partner with normally. So we've done our fire rescue department, our of course our community health representatives, they're called CHRs, our domestic violence program, they were a big, you know, oh, and our daycare. You would think that daycare would be, you know, wanting to help, but they paid for a lunch one time for us. And so it was a kid, you know, as long as it met some of the age requirements, they said, yeah, we'll purchase the meal for you. And so they did that. So you just kind of look in different places that just really offering that hand and saying, would you like to collaborate with us, or, you know, be a part of this and stuff. But a lot of times they do. People really would be more than happy to work with you and get your goals and objectives accomplished. But yeah.
Thank you so much, Ardina. I love this kind of conversation. So I appreciate all three of you sharing those wonderful methods that you utilize within your communities to make your community events flourish for your community members. And you've just shared so many great examples. And so I'm going to go to the next question. My next question is, because part of your collaboration and use of different funding, my question is, how do you report out to each funding source for a shared event? Right? So you may utilize different funding sources, but how are you able to then report out to those different funding sources how you made this one event happen?
Document. So when you're an organization like me, you know, we tend to have a fairly large presence, but the reality is we have 12 employees total, including myself. And like I said, 17 or 18 grants right now. I think I've got one sort of like on the edge. That's why I keep saying I'm not exactly sure the number. So with that, every single grant has its own requirements. Okay. And we know that like our SAPT grant or our PFS 20 grant, they have with BHSD are very can be restrictive in how you keep track of all of the pieces. So I'm looking at the question again, make sure I'm getting it right. So how do we report on the funding sources? So like I said, we really need to document everything. Each individual that I have on my team is paid by a specific grant. As much as possible, I have one individual that might be 100% with one particular grant or activity. But I do have several, including myself, who receive their basic salary from several different activities. So we have to keep track of our time. So we have a staff activity report that everybody within the organization has to fill out on a daily basis. That is collected at the end of the month. There are times when we need to send that into a funders so that they have a sense of what are we doing, how are we utilizing our time, and what does that look like? So keeping track of that documentation, any sort of something that that we might need to buy, any contracted work that we receive, we need to make sure that we keep track of the receipts with the specific thing that was purchased. Say we have a new project and we were able to buy a laptop with that, or you know, we have an epidemiologist who we contract with, and they have several programs that we're working with. How do we need to make sure that they are invoicing properly in order for that to be documented correctly and billed to the grant that they are working on for that. So that documentation, the breakdown of hours for a particular activity. I have one employee, Amanda Evans, who is our senior certified prevention specialist, who works on 3 different grants right now, but her focus is actually, it might even be more, but her focus is really on our media campaign component. So we make sure that she keeps track of who she's speaking with and what particular things she may be working on, so that for any particular product that she produces for media, that we are attaching her efforts to a particular grant and to particular activities that meet that objective. So that's really how we do it. It's a lot of documentation. It's a lot of collaboration. It's really myself and my office manager who manage these pieces, along with the documentation that we receive from the employee who is specifically working on an activity to make sure that we are within compliance. And then we maintain records based on those grants that we keep in-house, and we keep everything for 7 years. So I have, you know, everything back for the past 7 years, with, you know, that I know, like, I cannot get rid of this information and it's focused on this, just in case we were audited, especially at the federal level, because we receive so much funding at the federal level. So that's how we really manage that. And I know it's kind of picky details, and if other people have questions in more detail about what some of this looks like at any time, please reach out and I'd be happy to talk about it.
Thank you so much, Anna. I appreciate your initial documentation. Document. All right.
Yeah, and I just want to shout out Anna, because like she's amazing. And yes, I'm just going to piggyback and say ditto. No, I'm just kidding. But yes, I mean, all things great, right? When I worked in nonprofit, that's exactly what we had to do. And I can say, working for a larger system like Press and having such a great support system, I defer to our finance team. I say all things go to finance team, which is great, right? But, you know, when we're working with coalitions and collaboratives and we're helping on these initiatives, so again, in speaking to my example with the Native American Partnership, so we attend planning committee meetings, you know, where everyone understands their role, their responsibilities, including the budget, you know, so the budget, they go over the budget, what we have, you know, available for the entire conference or whatever we're planning, you know, the marketing needs, et cetera. You know, really important that you're meeting, you know, monthly. And then, you know, prior to the event, you know, I know, especially with the Native American Partnership, we were meeting bi-weekly for like 2 months prior to the event to make sure everything was aligned, you know. And it's really important that, you know, you bring everybody into those conversations and to decide what is needed for the reporting requirements. Because if you're partnering with them, you know, like, for example, the Native American Partnership, we were like, can we have the survey results, you know, so we can report on those. So they shared those, you know, the survey results that they got. We asked them to kind of break it down a little bit better for this conference because they didn't have surveys for the breakout rooms. So that was our ask for this year's conference and planning. Can we have surveys for each breakout, you know, since our teams are presenting. So we've changed the format a little bit and we're able to, like, you know, ask for that. You know, really at Presbyterian, you know, when we're doing big initiatives, there's always a big report that happens. And then, you know, the funding is referenced because it's all joint funding. So there's like a big report that goes out to all agencies. But, you know, for me, I'm super thankful my finance officer's on here. I'm going to shout Miranda out. Thank you, thank you, thank you. I will defer it to her.
Thank you, Elaine. Ardina?
So I'm gonna go in, answer your question 2 and 3.
Okay.
So it says, how do you report out to each funding source? And it can get complicated if you let it, but you've got to keep it, like they're saying, documented, knowing your goals and objectives for each of your grants. Our program, we're blessed with having 3 funding sources. We have, of course, OSAP. We've applied for PFS on the federal level, and then we were awarded an IHS suicide prevention grant. And so some of the staff members are all kind of, you know, paid under one funding source to keep it, you know, so it doesn't get clouded or anything like that. But everybody has their goals and objectives and they know what they are. But the other thing is too, is like, if not expecting just one person to take care of one grant. We all collaborate to make sure that all the goals and objectives are achieved, because that's what's going to benefit our community. You know, not having just one person work on the one grant and getting paid to do that. It's a collaborative effort within our staff. And that, when I say collaborative effort, it's all of our staff members, including our evaluator. So shout out to Ann too. She does a great job in helping us keep track of things. I ask her for, you know, making sure that we have, you know, evaluations all situated, that each one is pretty much covered. So that way we have, you know, what we need when it comes to the data and to show that we're making a difference in our community. That's, you know, the ultimate thing. But the other one, and I wanted to kind of piggyback off, was to go to number 3, was making sure that we don't do duplicating efforts. And so I've worked with Ann, our evaluator, is to come up with some strong monitoring sheets. So that way we know either where we're lacking or where some of the things maybe we haven't been accomplishing. Make sure that we're covering all of those areas, or we're noting where the barriers could be. If we're not, you know, or like one of the things I'll just say, it was trying to do our responsible beverage server training. We just couldn't get back into our, you know, our tribal retailers. So we discussed it, we talked and things like that. But, you know, finally we were able to get back in there to accomplish that. But we had to note that. And so we really had to have a really good, strong monitoring system for ourselves. Not necessarily required for any of the grants, but that's something that we took on so that we could make sure we're, you know, we're seeing where we're lacking, or where we're saying, okay, we're really focusing a lot maybe on one area and kind of not paying as much attention to another. So our monitoring sheets are very helpful in accomplishing all of those things for our community, you know, to make sure we're meeting some of those goals and things. And it brings out a lot of different areas maybe that we didn't think about before, or that we lacked maybe documentation or something like that. And it's a really good teaching tool for all of us in our department, I guess, so we can see where all the steps are needed. And for me, it's a really good teaching tool for my staff to show them what they need to get done, or what they need basically to accomplish the goals and objectives. So it's a really good teaching tool. That's what I use.
Thank you so much, Ardina. I think you three are such a, you carry a lot of wisdom with you, and thank you so much for your responses to this question. And I think you've pinpointed a couple of different areas that I just want to highlight real quickly. And you know, the documentation portion, the staffing portion, and then of course, you know, the differences, right, from one agency, meaning Aline can rely on her finance team to assist her, and how Ardina is utilizing staff's abilities to cover multiple areas, and you know, Anna reminding us too that, you know, attaching the work that they're doing to those grant specific activities. So thank you so much. I am going to try and squeeze in one more question because we are getting close to wrapping up here, but I want to I'll answer the last question, which is the well, actually, let's highlight a little bit more about the duplication, and so not a little bit of 3, and if you want to answer 4. So question 3 is asking to provide an example of how you ensure non-duplication of efforts. And question 4 is, how do you leverage strategies across funding sources?
Okay. So
whichever one of those.
Well, ensuring non-duplication. So, you know, we have an opportunity, right? We were able to update our SAPT strategies this year. And so I look at what are the needs of the community, and we have an incredible amount of data that kind of that informs what we need to focus on. And then we look at what are the funding opportunities available to us, and we target opportunities and apply for grants that are going to meet a particular need. I wouldn't apply for a grant that would be already duplicating some of the efforts that we're doing. So if I look at right now in prevention, we have the PFS 20 grant, which focuses on youth, and that particular grant is focusing on preventing the early use of alcohol and or cannabis products in the community. And then we have our SAPT grant, where we have strategies that really look at the school system and the prevention activities in terms of school policy for substance use, misuse of the youth. So that meets all of those youth criteria. We're also looking at how do we address opioid use concerns? How do we prevent with our PFS 20 grant overdose deaths in our community? And so what I have right now are 3 fairly large, well, middle to large grants that range the lifespan for the most part. So starting with age 9, going to 64. Those are so I have 3 different grants that can fit the needs of our community around those specific populations. And within those age populations, the specific concerns that we have based on the data that we have collected over the years. So I make sure that I don't have more than 1 grant that has the same activities. So that's how I really focus on non-duplication. You want me to go right into the next one, or let somebody else talk first?
Sure, go ahead and answer the next one.
Okay, so how do we leverage strategies across funding sources? Because I have prevention funding, housing assistance funding, and general community wellness funding, health council funding, things of that nature, I really spend a lot of time personally making connections. So I have a lot of connections with county government, tribal government with the Navajo Nation, city government, Farmington specifically, but we also have the cities of Kirtland, Aztec, Bloomfield, around us. So making sure that I'm connecting with all of those different communities, seeing what their needs are. One of the things that we do, and Noah and I are my evaluator are working on right now, is building a comprehensive needs assessment, which this organization has done for every 4 years since like 1991. So we're building one this fall to really make sure that we are meeting the needs of the community and addressing specific concerns we have, such as housing instability and homelessness issues are a huge one. Transportation is another big one. We've spent so much energy really looking at substance use and mental health concerns that we need to kind of shift that, see what's really working within the community. So building a tool to survey the entire community, including because 60% of our county is on the Navajo reservation. So we need to make sure that we're counting those folks and building that. And to fund that, because this is not coming from any of these grants at all, I count on city funding, county funding, hospital funding, and this year United Way has actually contributed quite a bit of funding to us to meet those efforts. So that's how I kind of manage, and that's one example.
Amazing work. Amazing work. I love needs assessments, community assessments. All right, Aline.
You're so funny, Tone. I love it.
Sorry.
No, it's great. So duplication efforts, I'll be quick. I know we're short. So really, I think the key is breaking down the silos, within, if you're in a bigger agency. So I'm speaking to, Presbyterian as a bigger agency. And really communication is key, acknowledging everybody's projects, what they're engaged in. I think a big key is like really having those check-ins, and not only with your internal team, but like external team. We really, from the jump, had meetings with behavioral health at the larger system to see what they were working on. So we weren't duplicating efforts, and they had some grants in regards to like Narcan. So how can we collaborate? What are you doing? What are your goals and objectives? And how can we assist you, and vice versa? So really having those open, honest conversations and, collaborative meetings is really important. And then, really tracking and measuring the progress, keeping track of all the tasks allotted to like each team. Are there action plans? Do you have realistic timeframes? My team, I created a weekly tracker. I know they hate it. They're all on here. Art, Joanne Davina, I know. I'm shouting you out, but they hate doing the trackers, but it's really to kind of help them stay, what are they doing currently, what's in progress, what's done, where they need to be, and then where they need to be with internal, external partners, being transparent, making your work accessible, having a shared folder in Teams, like with all the projects, the operating procedures, the database. This really helps facilitate and seamless accessibility to the program, and so people can see what you're doing and where you're at. And then just really outlining that expectation, the clear roles and responsibilities from like each team, each program. And then the key is utilizing each person's unique skill set. We all have diverse teams. And I have a great diverse team with many different layers and levels of training and experience. So tap into this, and really, I use my team to kind of, I'm going to shout out Art. He's our harm reduction specialist. He's certified, and he's helped create, help build more harm reduction specialists within our team and within our community health organization. So super helpful. He's been training Joanne and Davina to be harm reduction specialists. So I've really tapped into that expertise. Weekly team huddles, sharing tools. So, we have a Teams format where we have all of our everything in there where anybody can access that, in our community health department. Do I have time to keep going or are we done?
You can answer the last question and we can go over time. It's fine.
Okay, so let's see, leveraging strategies across funding sources, right?
Yes.
So really kind of speaking to what Anna already said, but there is often a lot of like crossover in evidence-based strategies, priority interventions and priority populations. So funders are usually happy if they can see you already have infrastructure, experience, partners, and community involvement. So depending on the types of funding sources, really try to like braid together the grants, like through philanthropy, operations, budgets, and contracts to work on the priority areas in a meaningful and sustainable way. Really building the strategies and interventions around the populations and then tailor based on like funding and benefits. So for example, if you have a strategy of reducing stigma and you're working on a zine, which my team is, shout out, you can seek a grant that that's looking to do the same thing to support that work. So, say for example, in the South Valley, they're really looking to do something like that. So you kind of lean on them to like help you support that initiative. So you really have to think about sustainability, right? Like, constantly looking for grants that support the work. So when you're using staff time, how can you bill for services? When salaries are paid for, can we add that into their role, or can we, how can we leverage that? So we've also worked with our foundation at Presbyterian. So basically we've done presentations to our foundation to say, hey, this is what we're doing. This is how we can support the community, presenting them data and the things that we've already done. And then, they help support the program to be sustainable through private funding or in-kind funding. So pass. Thank you.
Thank you, Elaine. Ardina, I think you already kind of chimed in a little bit on question 3, but you can expand on that and answer question 4.
Well, one of the things that I wanted to also, I guess, being in prevention is how you leverage, your funding and stuff like that is, what does your data say to you? What is it speaking to you? If you see like your number one issue is, alcohol, and then you go across and you say, well, that funding is for that. Well, we come across funding from another area and your next issue is, opioid use or something in your community. Well, guess what? You get to have some funding to start addressing that issue. So if you're really looking at your data and seeing what is coming back to you using, I forgot, that was one of the things when you said, what do you do with your New Mexico survey? We look at it, we study it, and we try to really see what our community is, talking about and what they like to see in our community. So using that data that comes from our community survey to go across and look for funding sources to address maybe some issues. We're blessed with, having our OSAP funding to address. For us, it's binge drinking and adult binge drinking and things like that. So what that means, well, we can go to a different funding source to look for, youth activities or things like that. And like I said, we have our IHS grant. So that helps us address suicide prevention. And one of the things that, I tell my leadership is that all of these funding sources, yes, they have different titles, but they are all working hand in hand. They're like pieces to a puzzle. And so it's all prevention work, the core. And so, yes, they might have different titles when it comes to funding sources, but they all contribute and they all work kind of like hand in hand. So if I do good in my suicide prevention, services and the things that we're doing over here, somehow it reaches over to my youth, my youth funding, my youth area. And then you work on those two, but guess what? It also is reaching over to the adult side of my grant, my funding and stuff. So it all works together in some way or fashion or form. Any dollars towards prevention kind of just goes across the board. So I just wanted to see that.
Thank you so much. Thank you, Ardina. Thank you, Aline. Thank you, Anna. So let's do virtual hands clapping or emojis. Please express some appreciation for these ladies. I really thank you very, very much for being a part of this panel. And you know, this is a topic that, you know, is so important as a prevention coordinator, prevention specialist. You do a lot of this out in your community, and you learn. It's so great to learn from one another, and that's kind of what I wanted to do, is provide this opportunity to hear from others and see how the different things, right? There's different. There was something a little helpful that you can try, right? There's something like, I never thought about that. I'm going to try that. So I just appreciate the sharing. So thank you so much for your time and your words, your wisdom. Thank you. Whew, this is wonderful. I love this. Sorry. All right. So day 2, we have just completed day 1 of our recipient meeting. And so just looking forward to day 2 tomorrow. Please be here in full force tomorrow. Tomorrow morning, we will start at 9 a.m. So please sign on at least a little bit beforehand. Make sure your computers are up and working. We will have Dr. Anna Nelson, and she is the director for the Center of Excellence in Social Work at New Mexico Highlands University. And I believe she just started working there not too long ago. So we're welcoming her back, and she joined us at the last recipient meeting. So I'm looking forward to her giving us more time. And so we'll have a presentation from her tomorrow. And in the afternoon, this is for the block grant providers. You will have the wonderful Carla Martinez Talavera providing you with your SINAR merchant education training. So please be there or be square. What that means is, if you have someone who is going to assist you, if you are the one providing SINAR merchant education, please be in attendance. Please be there. And if you don't have your person here and they're not able to attend tomorrow, they will need to email Carla and set up let her know so-and-so needs to be trained. You know, all that information. That doesn't excuse you from tomorrow. that doesn't mean this tomorrow. That means if there's folks that aren't here right now that need to attend, you may be contracting with somebody. You will need to schedule that with Carla at a later date. I will be writing down names. No, I'm just kidding. All right. So that's all I have for us for day 2. I want to say we've had a day full of very great information shared with all of us. And I know there's so much more. I'm pretty sure all of you have maybe more questions. And we will share the presentations, the contact information for, I'll ask our panelists later on if we can share their contact information, and we'll be able to share a little bit of that. Share their contact information so you can contact them for more information. Sorry, got that mixed up. Before you leave, I am going to share. Let me see, can I share? Let me see. Oh, I can share. So this is the word cloud that was created with all of the words that were shared this morning from this morning's activity. So we have adaptive, community, strategic, leadership, vision, Narcan, happiness, thinkers, productivity, inspiring, health equity. I love all the words everybody shared. Thank you so much. I'll share this with, or we'll be able to share this and send this out to everyone.
Tone, if you want to scroll to the bottom, you'll be able to see the answers from all of the 6 breakouts.
Oh, there's more. Oh my gosh. Okay. I did not know there was 6 pages, 7 pages. Oh my gosh. See, I was sitting here like, this isn't enough words, right? Okay, thank you. I needed that. All right. Leadership, innovative. That was my word too. Culture, strategic, native, well organized. It's nice. Next one. Always fun, data driven, receptive, transformative, culturally relevant, anti-stigma, diverse, leadership, humble, determined, challenging, compassionate, prevention, empowering, strength, competent, sophisticated, ooh, change making, teamwork, ambitious, coalition, oh yeah, hardworking, achievement, resilient, children, future, meaningful. And here's all the responses. 304 responses. Whoa, this is, let me see if I can make this larger. So I love when all the words come together. Oh, that was beautiful. Thank you all again. Thank you for giving me a couple more minutes just to share that. So again, we'll see you all tomorrow. I'm not going to keep you any further. You get the last 5 minutes back and have a wonderful afternoon. Thank you again.